Welcome, everyone. I think we're going to go ahead and get started. Thank you so much for joining us today for the Opioid Response Seminar Series. My name is Rebecca Taylor. I am the Deputy Director of Research and Evaluation at the Office of Behavioral Health, and I'll be moderating the session today. Before we get started, I just need to give you the usual boilerplate language that we sort of say at the outset of all of these sessions. So just a reminder that the personal views of the participants in this session do not necessarily reflect the opinion of the governor's office. And the participants in the session today have no conflicts of interest to disclose. Just a reminder that the next seminar in this series will be held on Friday, June 4th. And please just look out for an invitation reminder and an announcement regarding the topic for that session. And also this seminar and the recordings of all of the past seminars and the PowerPoints from today's session can be viewed on AdCare's website, the link for which is in the invitation confirmation that you received today. Any questions that folks put into the Q&A chat box will be answered in writing if we don't get to them during the live session. And just one final reminder, the governor's 2021 summit will be held in a hybrid model on July 15th. So it will be available virtually, and you also have the opportunity to attend live at a few of the recovery centers here in Maine. So registration and kickoff information should be announced later this month, so look out for that. And without further ado, I'm going to go ahead and get started. So I just put together a brief PowerPoint to make sure that we all stay, or well, me myself, because I tend to ramble a little bit if I don't have some guide rails in place, stay on track. But before I get started with that, I just wanted to let our their speakers introduce themselves. So Dan, do you want to start off?
Daniel Soucier. I'm a research associate at the Margaret Chase Smith Policy Center at the University of Maine, and my role here today is to kind of wrap up at the end and discuss how the hub, kind of the how and technical aspects of the hub. And I guess I'll pass it over to Penny to introduce herself.
Hi, everybody. I'm Penny Geisinger. I am the Recovery Programs Director at Healthy Acadia, which primarily serves Hancock and Washington counties, although we do provide services in other counties. And I am here today to talk about how data makes the grant world go around. And I will hand it over to Alane.
Good morning, everyone. I'm Alane O'Connor. I specialize in addiction medicine, wear a lot of different hats. I care for pregnant moms with substance use disorders and in the clinical lead of the Maine Maternal Opioid Misuse initiative at the state level, and also see pregnant moms at Maine Medical Center in Portland, which is what I'm doing today. I also do rural addiction medicine work at Kennebec Behavioral Health in Skowhegan, and then finally have the privilege of co-chairing Gordon's State Opioid Response Clinical Advisory Committee. And I'm going to give just a brief example about how one can use data to really help inform clinical practice and the role that the Data Hub would have in that. And I'll toss it to Marcy.
Marcy, you're muted.
I'm Marcy Sorg. I'm from the University of Maine. I'm the director of the Drug and Alcohol Research Program at the Margaret Chase Smith Policy Center, and I'm just here to support the team and answer any questions you might have.
Thanks so much, everyone. So since we only have a brief little time here, we'll go ahead and get started. Just sharing my screen quickly. Sorry about that. There we go. So, of course, today's topic is the Maine Drug Data Hub, which we are all super excited about. So I'm just here to talk a little bit about the impetus behind the Drug Data Hub, why we decided that it was a worthwhile activity to pursue, and how it got off the ground. So for those of you who have been exposed or aware of the Governor's State of Maine Opioid Response Strategic Action Plan, you know that one of the strategic areas in that action plan is to maximize the collection of actionable data and evaluate the impact of interventions. And so as part of that strategic priority, the Office of Behavioral Health, in collaboration with the Governor's Office for Progress, Innovation, and the Future, for which Gordon works, decided to stand up a sort of one-stop shop for all sources of data that we have available to us regarding substance use disorder. So we really wanted to make this data available to everyone who might have a need for it, make it publicly searchable, and make it easy to find. So that includes, of course, people who use drugs and their family, friends, and loved ones, as well as clinicians, treatment providers, harm reduction and recovery organizations which might need to access the data for grant writing or to inform their clinical practice, community organizations that have public-facing functionalities and might come into contact with folks who use drugs or their family and loved ones. Of course, public health and public safety workers who have a need to have awareness of the public health landscape as it relates to drug use in Maine. Policymakers, of course, need to have awareness of this data as well. And last but certainly not least, our academic research partners, who are really the ones doing the work of analysis and helping our state understand the lay of the land from a public health perspective and also a policy solution perspective in terms of drug overdose response and prevention. And so just to increase the transparency regarding what the situation is on the ground here in Maine with substance use and the impact of the public health interventions that the state invests in, we thought that a publicly facing drug data hub was a good solution to pursue. So just briefly, what kind of data can you find on the Maine Drug Data Hub? Well, when you visit www.mainedrugdata.org, the landing page is essentially an easy to consume and digest, visually appealing dashboard of different substance use disorder related metrics that are updated on a monthly basis. These metrics are drawn from the 5 strategic areas of the Governor's Opioid Response Plan. So prevention, treatment, recovery, harm reduction, and leadership. You'll also find a searchable index of Maine-specific substance use disorder related data sources, including fact sheets, dashboards that are supported by other state agencies or offices, as well as monthly, quarterly, and yearly reports that are put out by the various offices that handle different types of substance use disorder specific data, and presentations that have been given either within the state to the legislature or in other sort of publicly facing settings related to substance use disorder. This is just a very brief overview. I really recommend going out and visiting www.mainedrugdata.org and digging into it for yourself. So what are some of the agencies that contribute data to the Maine Drug Data Hub? Well, so at the beginning, this Drug Data Hub was an offshoot of a collaborative group that convened around the state stakeholders which offices do work relating to substance use disorders. So the impetus of this meeting was to share drug data between and among state offices. And as these meetings were progressing, we quickly realized that the folks in the meeting were not the only ones that needed access to this data. And so as an offshoot of the Opioid Data Sharing Committee, the Maine Drug Data Hub was born. And some of the agencies that participate in that Opioid Data Sharing Committee and also contribute data and resources to the Maine Drug Data Hub include the Department of Health and Human Services, of course, the Office of Behavioral Health, where I work, which contributes treatment, recovery, harm reduction, naloxone distribution, and prescription drug monitoring program data, among many other data sources. Maine CDC, which contributes hospital data, including emergency department and inpatient visits related to substance abuse, use, as well as the Health and Environmental Testing Lab, which handles the urine and blood drug testing functionality for Maine. The Office of the Attorney General and the Office of the Chief Medical Examiner, which thanks to Dr. Sorg's team at the University of Maine, is now producing a monthly drug overdose fatality report. The Department of Corrections, which provides data on the treatment modalities and engagement levels for substance use related treatment in their facilities, as well as some statistics around the number of individuals who are incarcerated due to substance related crimes. And the Department of Public Safety, including emergency medical services, law enforcement, and Maine's Drug Enforcement Agency. What else can you find on the Maine Drug Data Hub besides just all of this data, which is a lot? Well, you can also sign up for email alerts so that you will be notified via email when new data sources are added to the hub. There is an email address as well where you can ask for information or help related to the data that is on the hub. There's also a link out to the Office of Behavioral Health website regarding where to find naloxone and where to get help with substance use disorder if we wanted to ensure that any friends, family, loved ones, people who are experiencing substance use disorder, if they do happen to land on the hub and they find that they need to link out to any of those resources, whether it's looking for treatment or recovery support, harm reduction, looking for naloxone, that those resources would be easily available on the hub, as well as a link to our options program, which you heard about a couple of sessions ago, and we're very proud of. And finally, a list of upcoming events related to substance use disorder in Maine, including the Governor's Opioid Response Summit and other events. So just briefly, where are we going with the Maine Drug Data Hub? Well, this is just the beginning. The hub actually only formally launched about 6 weeks ago, and we have a lot more that we would like to do with the hub. It will not be a static resource. It is updated on a regular basis, and we are investing time and energy and resources in making it as user-friendly and interactive as possible. And Dan Soucier is here to talk more about that, but just very briefly, where we'd like to go is to have some interactive Tableau. Tableau is a data visualization software, and we'd like to make our visualizations that you find on Hub interactive and more user-friendly so that you can sort of search and filter data and, for the folks, for example, like any who need to access specific data for their grant writing purposes will be easy to do without needing to sort of send a million emails to different state folks to ask for data. And we're also planning to include GIS story maps. What that means is those maps of the state by county or by census area that sort of depict in hotspotting terms where specific either events are occurring or where resources are located. So where harm reduction resources are located or where treatment agencies are located. And of course, we want to bring in additional data sources from other state offices and departments There are so many different state agencies that have some sort of contact with substance use disorder in Maine, whether it be the Office of Family Independence or the Office of Child and Family Services, the drug courts, which is an Office of Behavioral Health program. So we're always working to include more data from more different sources, such that we're being as transparent and available as possible with state data sources. And we also would love to include reports from our academic research partners, for example, those folks at the University of Maine system who are doing really important research work around understanding evidence-based strategies for addressing the substance use disorder situation in our state. And finally, not directly related to the hub, but kind of the logical next step of the hub is something that we're calling the Master Data Repository Project, which I know is kind of a technical jargony title, but what it essentially means is, so the Maine Drug Data Hub is a collection of independent data sources, sort of all in one location and easy to access. The next logical step is to link together those data sources at the person level so that the state can better understand where folks are intersecting across different programs and organizations and interventions, and have a better sense of where folks might be falling through the cracks, what particular subpopulations aren't being adequately supported, those types of questions. So we're really excited about that. It's in its very early planning stages at the moment, but stay tuned for more information. So that's all I had to say as an introduction. And I will stop sharing my screen and hand over to Alane for her take on the Maine Drug Data Hub and how it can be used in clinical work.
Great. Thanks so much. You can hear me okay? Yes, that's good. Excellent. So I'm just going to give a quick clinical scenario of how one can use this data when you're practicing in clinical practice. It comes largely from my work in Skowhegan with a rural patient population of all ages with all different types of substance use disorder. There we go. So I like to think of this, so I should first preface with saying I'm a clinician researcher very much. So I like to sort of understand things clinically and then also look at the research. I think it's really important to state sort of up front that, you know, I look at a lot of correlations, which is not necessarily cause and effect. So as a clinical researcher, I want to say that clearly, but just try to look to see what's going on in my own clinical practice. And then what do I know about what's happening in the state? And then what do I know about what's happening nationally as well? So this is some scenarios I've run into over the last couple months. I had a patient who came in who was incredibly upset about the overdose death of a woman who was in his family, who was in her 60s. And what was actually most distressing to him was the fact that there was naloxone actually available in the home. And no one used it because nobody recognized it as an overdose. And so there was, actually multiple kits available, and he was really struggling with the fact that, potentially this person could have been saved if somebody had actually used the naloxone that was there. There was a second case about a month ago where I had a patient who came in and she was very distressed because she had experienced the presumed overdose death of two of her classmates and she herself was 56 years old. And so she was talking with her daughter about this, and she said, my daughter could not believe it because how could someone that age still be doing drugs? And so the mom was really trying to wrestle with, how much do I tell her? What do I talk about with my child, and how do I sort of better inform her about the fact that this is a disorder that affects people of all ages. So I went to look in the literature, just sort of the national-based literature, and you'll see that actually since 2013, the estimated rates of OUD among Medicare beneficiaries has increased more than threefold across the US. So this is a problem that's really emerging across the nation. And we're also seeing a marked increase in ED visits for adults that are 65 plus with opioid misuse. So that was up by 220% during the 2006 to 2014 time period. So we're definitely seeing it increase across the state. And then you can go to our own drug data hub, because I really wanted to understand, what's happening in our state versus the country. And you could see that there's a much higher percentage of individuals who actually end up in the emergency room. So you can look at the ED data, the EMS run data, the folks that largely end up there with overdose are the younger folks, so ages 20 to 34. Despite the fact that you see actually 60% of the overdose deaths were in individuals that were 40 plus, and many of whom were actually over the age of 60. So I think that sort of really helps affirm that there are people that are really recognizing overdose amongst the younger population, but not necessarily the older population. So when I think about interventions, I try to sort of target, patients sitting right in front of me. So there's sort of clinical interventions, but also definitely community interventions. I think there's a role for us to educate more broadly within the community. So really important to talk about the fact that older individuals do not necessarily age out of substance use disorder. So there's both individuals that, may develop a substance use disorder later in life. I've certainly had some of those. I was talking to a colleague the other day of a woman who developed a significant cocaine use disorder in her 60s and didn't previously have any use disorders. And the other thing is that people are in treatment a lot longer. So we know that people stay on medications for opiate use disorder treatment for sometimes, 20, 30 years or longer. So they may still be in treatment later in life. Really important that screening for substance use disorder needs to be universal. I mean, I know a lot of folks on this call already know that, but it is overlooked in a lot of older populations. So this is not uncommon if you see a patient present to the emergency department who might seem impaired or who had a fall, for example, where in a younger population, they may be like, oh, a fall, that doesn't quite make sense, or there was an accident of some kind, was the person impaired? People may not be thinking about that with older populations. Certainly an increased prevalence of chronic pain amongst older folks or mood disorders. So they may be self-medicating for other problems with substances, whether those be, prescribed medications or illicit substances, or certainly alcohol as well. Important to educate my patients. So I see people up to the age of 65 or more. So I try to educate my patients that are a little bit older about the change in your body's ability to absorb and filter medications with age. So that definitely tends to slow down. So you may see situations where patients kind of inadvertently take too many medications and it accumulates in their body because of the way in which their body changes in terms of their metabolism. You certainly see more unintentional overdoses, so maybe due to memory concerns. So did I take that medication or did I not? I think those are the benefits of using pill boxes and things like that. Also the changes in metabolism that I already mentioned. So that's certainly occurring. And also, I want to sort of hit home that we certainly see, ongoing illicit substance use within patients of all ages. It does not discriminate by age. And I think one of the pieces I've really tried to educate both my patients and also just the broader public, as well as the folks who are out teaching the naloxone overdose courses, that there are very, very few downsides to trying naloxone, even if you're not sure it's an overdose. So I think there's this feeling people have that like, oh my goodness, if somebody was not having an allergic reaction to a bee sting, I certainly wouldn't want to use epinephrine. And that's pretty true with epinephrine. There's some definite downsides to using epinephrine if you don't need it. With naloxone, very, very few downsides. So if it's there, give it a try is what I tell pretty much everybody. If somebody's having a cardiac event that's unrelated to opioids and you give them naloxone, it's not going to work, but it's also not going to make the situation any worse. So really trying to think about that woman that was in her 60s that was, having an overdose that nobody recognized, and would she have been saved if somebody had used the kits that were in the home. So also trying to certainly work with community partners to expand access to naloxone, both for reversals and distribution. And we're seeing, again, if you look at the Drug Data Hub, an increase in naloxone administration among overdose victims. So a steady sort of trend up, which is great. So we're getting more folks who are having, naloxone administered, still not enough, clearly. So making sure that both your patients have plenty of access. I work with the local police department to make sure that they both can carry the naloxone themselves to use in situations that require reversals, particularly since oftentimes in rural populations, the response time is quite long, but also so that they can distribute it if they end up at a overdose call, that they can, and the patient does, declines to come in, or they want to leave a naloxone kit with a concerned family member, that they're able to do that as well. So we want as much naloxone out there as possible, harm reduction for sure. And we're seeing more and more as the potency of the fentanyl really increases, the requirement to have multiple doses of naloxone to be able to really effectively reverse somebody. And again, in rural situations where the response time might be long, I've certainly had situations in my own clinical practice where people required 6 to 8 doses to really reverse that overdose. So this is all bits of information that folks need to have. So that's just a quick clinical picture that you can really use the data that's available on the Drug Data Hub to support efforts, support education, to really understand, if when you're starting to see clinical trends in your own practice, what's happening across the state, and how do we sort of respond to that, both from an individual patient perspective, but also from a community and systems perspective. So I'm going to pass it off to Penny. Stop sharing my screen here and go back on mute. Thanks, Penny.
Thanks, Alane. So I'm going to give kind of a grant writer's perspective on why we need data. Again, I'm the Recovery Program Director at Healthy Acadia, and we provide coaching, training, clinical supports, community awareness services, harm reduction, a whole bunch of stuff across primarily Washington and Hancock counties, but there are 7 other counties where we provide services as well. So it's a lot of stuff, and it's all supported to one degree or another by some level of grant funding. I've been writing grants in Down East Maine. I've been with Healthy Acadia for just a couple of years, but I've been a grant writer for a couple of decades, which is shocking to say, but and I am one of the only people who can say and mean that I actually really like writing grants. I know some people hear the word grant and they get a twitchy eyelid, but I'm a storyteller at heart, and grant writing is really about telling a compelling story about a challenge that we're facing and how we propose to address it. So we are excited at Healthy Acadia and among all my grant writing friends about the new data hub, because without data, it's much more difficult to tell the story of the work that we do and why it's needed and why it's effective. So we use data in this way of telling stories. So I'm just going to I'm sort of looking down the list of people who are here, and I know there are people in this room who already know everything I'm about to say, but for those who don't, I'm going to just give a glimpse of like what I mean when I say that we use data in grant writing. So an example, we just received a very exciting new federal grant that we're going to put to work supporting pregnant women with substance use disorder by wrapping them in social, emotional, and medical supports before, during, and after the birth of their babies. So it's a 4-year grant, which is really a gift. It connects 5 different hospitals, a tribal health center, and a dedicated resource navigator who can work one-on-one with moms and babies to connect them to community services. And that's really like the Cliff Notes version of all the things that it does. But it's a really, we're thrilled to have received it. And I just want to show what I'm talking about when I say, I'm going to share my screen here, that it doesn't happen without data. And what I mean when I say we use data in grant applications, because it's kind of abstract until you see it. So this is, it's called the Prosper Initiative, which stands for this really long thing that you can read and yourself in it. This slide identifies all of the entities who are involved. And these are the data points. I'm not going to spend a lot of time showing you this. It's really just a visual. This is what we had to provide just to apply. We provided a lot more than this. These were the required things. Like no one gets funding without these things. And then I'm going to kind of quickly go through a series of slides to show you the data that we will be reporting to this funder every 6 months. And this is designed to shock you. Oh, I can't get it to advance. Okay, so you're not going to have time to read all these. Just take a look at the sheer quantity of things that we will be gathering twice a year to report to the funder. So it's multiple slides of things. Not all of these things will be available on the Data Hub. Some of them will, some of them we get other places, but this is really just a look at how we use this, and that we really do have to use it. So that's really a glimpse. Also increasingly, so this is just like a list of bullets of why this matters and how we use it. So, and some points in addition to this, increasingly we are asked to drill down into specific populations, as we really should be. So populations like people of color, new Mainers, LGBT populations, that it's getting more granular, and it should be, and that's wonderful, and we have to collect it and be able to access it. So how data supports grant writing, it defines the scope of the problem. Grant writing is kind of a weird business because we kind of traffic in problems, right? Like as a grant writer, part of my job is to provide the funder with the most terrifying demographic that I can paint, right? Like, because we have to show that their problem is real. It identifies the needs. So it shows the funder that their investment will make a difference. If they make this investment, that it will move the needle. It talks about how we'll do it. And then it measures and demonstrates the impact, which is what all those reporting data points are about, right? They need to see that the investment is paying off. And we have to be able to prove it. So the ongoing real, live, monthly, on the ground data allows us to do that. So we're very excited that it's becoming available. Not all grants have the same reporting schedules. So, you know, we may have one that's every 6 months and we may have another one that's every 6 months, but if it's a different 6 months for each of them. So having the monthly county by county sort of modular data allows us to build a report for the funder that tells the story that they've asked for, and that they're supporting. Beyond grant writing, though, it also allows us as an organization that provides programming to understand the landscape that we're working in, kind of like what Alane was just talking about a bit, that if we see things changing, we see trends, or a pattern, like maybe there's an intervention, a program we've been running that's working, right? So then we know to strategize to do more of that, or we may see a thing that could be better, it could be working better. So then we can tweak that program and respond and tool our programming to be very responsive to what's happening on the ground. So, and we use it, you know, there's fundraising that goes on outside of grants. Just community outreach, everything is development. So anytime we are able to tell a story to our community, to the people in our region, to the people that we're serving, it builds momentum and it builds further support to continue this work. And so it attracts volunteers, it attracts, you know, all sorts of things. So this real-time data and its availability is very, very exciting to me and to my grant writing team. And I think that's all I have to tell you. And I'm just gonna stop talking and hand it over to Dan.
All right, hello everybody. So like Penny, I'm excited about the data. So I'm going to jump right into a demo of the Data Hub and forego a couple of the slides I had prepared. I will talk a little bit, real briefly though, first about some of the technical aspects of the hub and you know, some of the stuff that that Rebecca had touched upon as well. So we had a few sort of developmental rationale for creating the hub. We wanted our data to be discoverable. So we sort of framed it around the strategic action plan and have multiple pathways to get at the data. We wanted to sort of link together, like Rebecca said, the public health and public safety data footprints. We wanted to reduce redundancy. So we really see the mission of the hub, not only housing data, but also housing various reports and other dashboards. We really intentionally called it a data hub as opposed to a data dashboard to drive that point home that the idea is not only to house data, but we also see the mission of the hub as redirecting folks to other resources that exist out there, right? So we have great websites like the CDC's Syndromic Dashboard, SEOW's Prevention Dashboard, the Know Your Options website, right? So there's no point in reinventing those wheels. Instead, we redirect folks to that data. So in a lot of ways, you can think about the Data Hub as like this wormhole that connects data universes together. And then the other thing we wanted to do was have the ability to be nimble and to expand. You know, data is reported at different cadences, whether it's annual, monthly, quarterly. Some data is earlier in the month, some's later in the month. So we wanted to be able to have it be fairly nimble, updatable, changeable. We could change the metrics around, curate the metrics in a variety of ways to make the hub most useful for folks who will be using the hub for grant writing or clinical practice or other things. So with that, I will hop right into sort of a demo of the Data Hub. And so it looks like a lot of web pages I'm sure you all have seen before. We have some navigation navigation at the top of the screen. We have a little search icon at the top of the screen. I'll talk about that as we get to as I run through this main landing page a little bit with you all. It has some information about the strategic action plan. And then like Rebecca had alluded to, has some visuals. We sort of curated a variety of metrics that bring you through some of the key areas of the 5 focus areas of the strategic action plan, which are leadership, prevention, harm reduction, treatment, and recovery. So we have a little dabbling of each of those. And the way the maps and the graphs and things work on the hub is that we have embedded hoverovers in them that give you not only the data point that you are looking for, but also provide some contextual data, right? So this map is fatal drug overdoses in Maine, January through February 2021. It gives you that data point, but it also gives you January through December 2020 deaths, and then the percent of the census population for 2019 for the county. So it helps build that broader picture of what is going on. So we also tried to provide some narration of data to not have the data just sort of live on its own, right? But to provide some context to sort of help with the analysis of this data. And same thing with the charts. I can show you. It has, so this is deaths in Maine by quarter, 2013 to 2020. And the hoverovers of the various quarter spits out the data points for you. So this is what the main landing page looks like. So we have some metrics for you. We have recent additions to the Data Hub. And so whenever I make updates to the site, I update this and say, hey, this is what I've been up to since the last time you've been on the site. Here's what here's the data that has been provided. So we have that. So this is a great place to check if you haven't been on the hub in a while to see what the latest 3 updates are. And then here, it might be hard to see on the screen share, but we have an email address, updates@mainedrugdata.org. You can sign up. I'm building a listserv. So whenever I make updates, it automatically pushes it out to y'all so that you can keep apprised of the new data that is on the site. We also have a little section of recent substance use related press releases for the state. And then that brings us in, how do you navigate the site, right? How do you get the data beyond this kind of curated data? So we set up 2 things, one not so novel, which is direct navigation, where you can directly dive into the metrics you want to see. And then one that's kind of novel, which is these user type navigation portals. So you kind of select the one that you most closely identify with, and it creates another landing page, much like the home screen landing page. And I'll highlight that for you in one sec. I'm just going to drop down to the rest of the home page for you. So then we have the search bar again down at the bottom, and a couple other emails for either support. So say you're having technical issues with the site, or if you have a data request, right? You see that there is a certain data set on the hub, but you want more granular data, right? So you can email that. The UMaine team checks that and then we'll try to connect you with the data gatekeeper who can possibly answer that question for you. So the search bar and the little search icon that was at the top of the screen functions a lot like Google, right? So you search, say you search naloxone, it will bring up every time naloxone is mentioned on the site, every subpage that exists, and then you can click and navigate through that. I'm sure you all know how the search engines typically work, so I won't demo that. I'll save my time for other things. So let's say like Alane, you're a clinician and you are looking for data that might be pertinent to you, but you don't really know where to start. So you can click on this user type navigation of clinician. This landing page begins with some info about just general info from the strategic action plan, about the challenges of substance use disorder in Maine, has some data from the National Survey of Drug Use and Health from SAMHSA on prevalence rates, buprenorphine trends over time, opioid prescriptions and benzodiazepine prescriptions over time. So this landing page is kind of curated with metrics that may be pertinent for clinicians. And then there is a bit of information here about the Maine naloxone distribution program. If you would be interested in naloxone distribution or referring people that you might think would be interested in that, or even folks who are interested in receiving some state supplied naloxone. And also we have the cumulative and monthly reported reversal trends here. This is kind of a different graph than I showed you before. So if you highlight a point where there's two lines, it brings both data points together, which is pretty interesting because it allows you to say, okay, September 2020, what's the whole picture look like? And so if you were looking like at a metric like law enforcement drug seizures, it would bring all drug categories together into that month. So it's kind of an interesting way to be able to view the data. So at the bottom of each of these use cases, right? So you run through that and you say, well, I'm really interested, like Alane said, in age, right? And I didn't find anything about age here. So what can I do? Well, you're able to directly navigate the the data on the data hub. And so we'll click on Maine Drug Data. Brings up a bit about the strategic action plan here, and all of the metrics on the site, like I had said, are sort of organized by the structure of the strategic action plan. So they're all filtered in through either leadership, prevention, harm reduction, treatment, and recovery. And I have a little, there's a little blurb here that talks about the various metrics that are housed in those. But the most powerful tool on the website, so those are good for like serendipitous discovery of resources, but the most powerful tool on the website is this data metric summary table. So with the time remaining, I will highlight how that works. So this serves really, I think, as a great data index for the site. So at its crudest, you can simply, it looks like there's 66 different data metrics on the hub right now. As they are added into this index. So all the data that exists on the hub exists in this data metric summary table. So at its very like broadest point, you could simply just go, I want to see 100 entries, right? There's only 66, and then you could just read through them all and say, okay, this is what I'm looking for or not. It gets a little more refined. You can sort these alphabetically. So you can sort metric alphabetically. You can search focus area alphabetically, and it works ascending or descending. Agency that houses the data, ascending, descending. And then these last things deserve a little bit of unpacking. So latest data set is the latest data that exists on the hub. So you can see the second one, doses of state supplied naloxone distributed. Our latest data set for that, we have data from March 2021. The most recent data, so what does that March 2021 look like? Well, that figure is 6,794. And then what's the year-to-date total of doses distributed? And that's 16,806. So without diving into the hub and into the graphs, if you're just looking for some quick take data, this is a good way you could get at that. So this is a pretty powerful tool for the website. The other thing you can do, which is also, I think, pretty powerful with this, is has a search bar. So let's say you were before I go back to Alane's example of looking at age metrics, let's say you were interested in all of the metrics on the hub. Let's say you were a public safety official and you were interested in naloxone distribution and what was going on throughout the state in that realm of harm reduction. Well, you could simply type naloxone into the search bar, and it brings up every metric on the hub that deals with naloxone. So we see there's 12 entries here that deal with naloxone, and you can click on these. They look like hyperlinks because they are, and it will bring you to that direct portion of the hub. So we'll search for age. And we can see, of course, agency comes up because of that, but we see age composition of monthly overdose decedents in here. So we were interested in our sort of example here of age. So we click on that. It brings us to the monthly overdose report. And we can click through to February. And in here, if we scroll down, there is age and gender composition of decedents for the month of February, and also the month of January as well. So each month, as the monthly overdose report is released, this data gets updated. So that is one way. So if you were, looking at age breakdown, this is one way you could get at that. And so real quick, I will show. Hop back. Are you still seeing? Let's see. So let's say we'll use Penny's example, right? So let's say you are looking at overdose deaths for a grant. You could type deaths into the search bar. Whoa, it'd help if I spelled it right. I don't have my glasses on this morning. Deaths into the search bar. We have quarterly overdose deaths. So I'll click through this, and it actually brings you directly to that portion of the data hub. In deaths are housed under leadership, but it scrolls down the website for you. So that actual portion of the hub where those statistics live, where that data lives, is shown for you. And then from there, you can click on the report, maybe that it came from, if you're interested in the source. You can explore the leadership page otherwise. So that gives you some serendipitous discovery of things. But this is, so the data metric summary table is the one major tool that will allow you to find the data you're looking for. And then one last thing I will show you, and then we'll leave 10 minutes for Q&A, is like we had said, the benefit of the hub is that we designed it to not be redundant, so that all the other sort of great state websites that are out there, this doesn't replace it. Instead, it can redirect you to it. So let's say you was really, you heard good things about the options program, but you couldn't remember the URL, right? To redirect somebody to options. So you could go to reports and websites here. And I have some quick navigation up top. You could click resources and websites. And they're all sorted by agency, Office of Behavioral Health. And then you could click through Know Your Options, and it brings you to the Know Your Options URL. So you would be all set to go. So if there's any sort of programmatic things that you're trying to grasp at what the URLs were, or maybe you were a legislator who was looking for the prescription drug monitoring program report, you couldn't put your fingers on it, you would come to the hub, click on the reports and resources, and be able to sort through and find it from there. So with that, I look forward to any questions you all have for any of us, and I'll throw it back to Rebecca to moderate the question and answer.
So much, Dan. I wasn't too sure how Dan was going to pack an entire overview of everything that's on the hub into 15 minutes, but he managed to do it. Very impressive. So I would love to take any questions that folks have about the hub or the sort of future plans or anything whatsoever that bubbles up into your brains having seen this, all of us talk. I'd love to hear from you. And I think you can just unmute and talk if you would like to. And now we will sit in awkward silence while we wait. I'm trying to use silence, but I'm not very good at it. I need a little cricket noise. Any thoughts from our audience about data sources that they would like to see on the hub that they didn't see during the overview? Oh, I see one question. Meg says, I know some reports will have county-specific data. Is there an easy way to find those in the hub? Dan, do you want to answer that?
Sure. So right now, I think the only county-specific breakdown we have is the monthly overdose reports, but we are working, one of the big things we're doing as we're transitioning to some interactive graphs and data points and things like that is that we're going to be putting up some geographic county profile data up on the hub, and that will be all searchable through the data metric summary table as well. So I will be able to put up in there things like, you could search out a Aroostook for Aroostook County or whatever the case may be to be able to get that data. That is something we're moving towards very quickly.
Also, I know that from an Office of Behavioral Health perspective, we're working towards more county-specific data reporting as well, so that we can better understand sort of the needs of specific counties. So please do stay tuned for that as well. There's another question in the chat. Let's see. Why did buprenorphine prescriptions go down in March of 2021? From Ann O'Brien. That's a great question. That's something that we noticed as well from the prescription drug monitoring program data. I would say that we don't have a clear answer at this point. Those prescription totals do fluctuate month to month, but that, as you noticed, was quite a decline, even in the context of fluctuating numbers. That number did rebound in April to sort of pre-March levels, but that's something that we're digging into with our sort of clinical staff to understand if there was a cause or some sort of change that we at the sort of state level aren't aware of, and if anyone has thoughts about what that underlying cause could be, I'd love to hear about it. Let's see, there was another question in the chat. Again, if we don't get to all the questions, we'll be answering them in writing after this presentation. What has happened to the old PDS WITS data? That's a great question. So the Office of Behavioral Health does actually still use the WITS system, although so sorry for anyone who doesn't know what WITS is. WITS is a web-based interface supported by FEI systems that is used by substance use providers to enter treatment episode data for all of their clients. And we as a state use that to gather the data that Substance Abuse and Mental Health Services Administration, SAMHSA, requires us to report on a quarterly basis. So the Office of Behavioral Health is transitioning from that FEI systems WITS platform to a data collection system via our administrative services provider, KeyPro, that will essentially allow a reduction in the administrative burden on providers to sort of enter data into both their electronic health records, the KeyPro system to gain authorization to treat and bill, and the WIT system. So by using KeyPro to collect that SAMHSA mandated data as well as the authorization information, we're cutting out one of those data entry and collection mandates for providers. So look for more information about that, communications coming out of the Office of Behavioral Health. And please feel free to contact me if you have questions about that as well. But to answer your question more specifically, that data does still exist, and we use it to inform the metrics that are currently on the hub with regard to treatment by substance being used and other indicators of that nature. Let's see. Heidi Wheaton says, I'd like to know about any studies and or data on recovery residencies that are supporting women with reunification with their children or pregnant mothers. And Alane had to hop off, and she's probably the one who could speak with the most information on that question. So Heidi, I will ask Alane get back to you on that question, if that's okay. Madeline Shiley says, as someone who works on youth SUD, it would be great to be able to break down the data where possible between age groups 12 to 17, 18 to 25, etc. It would also be so helpful to have an age filter added to the Know Your Options page. Is this a feature being considered for future editions? Madeline, that's a great question. I know that yes, we absolutely want to be able to allow folks to filter by various person-specific groupings such that they can access data for those age groups like you indicated. And that's something that we're working towards with our next iteration of the hub. It's really also a matter of how the data comes in. So some treatment collection modalities are different than others in the way that they collect the data. And if we don't have specific age, then it limits us as sort of like data crunchers in being able to present that data out in specific age groups. But I, absolutely recognize the value of that, particularly for the purpose that you indicated with the youth specific data. So yes, we are working towards that to the extent possible. And with regard to the Know Your Options website and the filter for youth, that is a great idea. I don't actually know if that's been considered, but I'm happy to take it to the folks who do manage the options website and raise that point with them. Let's see, did I catch all of the questions? I think so. Great. Any other last minute? Oh, let's see. I thought I saw another one, but maybe not. Okay. Well, we are at time anyway. So if you do have any other questions, my contact information, I believe, was in the invitation. And if not, we can certainly get it to you via the AdCare folks. And Dan kindly just put his contact information in the chat as well. Thank you, everyone, for joining us today. I really appreciate your time and enthusiasm for learning more about data. That makes me, as a proud data nerd, very happy that I have colleagues out in the world who are as excited about being able to make this data available as I am. Thank you, Penny. And I just want to say one last thing. This initiative would not have been possible without the help and assistance and dedication of the University of Maine team that Marcy Sorg manages. So I want to give a huge thank you to them for all of the work, and particularly Dan Soucier, who is an artist with data and really the brains behind our hub and its organization. So thank you so much, Dan, for your work on this. And with that, thanks everyone for joining us today, and have a lovely weekend. Happy Mother's Day to all of those moms out there. Bye.